There are definitely states that are moving quicker than what the federal guidance shows. And this is variable across the country. And I almost think it's inevitable as people have basically bristling under this level of economic shutdown that's been going on. So it is quite understandable that states want to go forward. However, when we do this, it's going to be important to realize that you're doing this at a cost of creating more cases, creating more hospitalizations, and really worrying about hospital capacity again. And hopefully, even the states that are being a little quicker than the guidance, that they have an eye on hospital capacity. They've done the calculations, and they won't run themselves back into any kind of crisis level, and not have to think about reinstituting social distancing, because that would be even more disruptive. The federal government has not really done a good job with this. They've not been something that's served as a coordinating role. We've had governors fighting with other governors over the same resources. We've had governors making international deals on their own to get testing. This is all something that shouldn't happen. The federal government should be providing a coordinating role where they can help get resources to those states that need them and manage this in a much better way. So I do think that the federal government has really faltered in its response to this pandemic. This pandemic is likely to last for a year or maybe even 2 years more. And we do need to be hearing from voices on the pandemic task force, especially including the CDC director, who has really not been as vocal as we should be. We're used to hearing from the CDC. We should be hearing from the CDC on a daily basis. I think that the briefings of the task force did get very disruptive and very distracting because of the politicians being involved. But hearing from the physicians on the task force, that is essential and will remain an essential need throughout this pandemic. The overriding concern to me has always been hospital capacity. And once the hospital capacity problem has been solved, I do think then you have to think about, how do we move forward? Because the virus isn't going anywhere. And the alternative is to keep people in a shutdown until there's a vaccine. And I don't think that's tenable or anything that's desirable. So the question is, can we move forward in a safe manner with an eye to hospital capacity, and allow for the fact that we're going to be living with this, and that this is going to be an individual risk decision for many people, and they're going to be vulnerable populations that are going to continue to have to shelter in place as best as they can.